So I'm really glad to have a technology that allows me to get off of using a lot of the antibiotics.
What do you say to all the stuff we're reading about that antibiotics aren't effective on chronic Lyme, just on first bites?
Well, they are in my patients, okay? I mean, very high success rate with antibiotics, but it's gotta be done properly. I mean, you've gotta protect the gut. You've gotta watch out for resistance, and there's ways that we do that. I mean, so I would disagree with that, and I think every Lyme doctor out there would disagree with that. There are some physicians out there, Wormser for one, who wrote, one of the 3 people that wrote the IDSA guidelines, the Infectious Disease Society guidelines. I mean, they don't work. We proved it with study after study. They don't work. Well, yeah, they do. We proved it with study after study saying that they do, and people do respond.
What you're using it as a first tier, that's what you hit it with first, and then you go to the light therapy and herb. Why do you do that first? Is there a reason? Is it bringing things out?
Well, one of the reasons is because I use everything I can to treat Lyme because it's that difficult. And there's no one thing that is probably going to treat Lyme, okay? So it's like doctors that just use antibiotics, and there's some in this state. I see a lot of their patients because, they're just using antibiotics. They'll get better, and then they get worse. And they go back and they get more antibiotics, and they get better, and then they get worse, and they go back. And you can't treat all of the forms, I believe, with antibiotics. You need to have herbs in there. You need to have some biofilm busters. You need to go after those cysts. Antibiotics alone, in my experience, aren't enough to get it done. So, but I don't think IV alone is the best way to go either. I wouldn't treat anybody with absolutely only IV or this UV treatment. When I say IV, I'm talking our ultraviolet light treatment,
What about after you think you've got somebody in remission? Do you keep them on herbs? Do you keep them on something for life so this doesn't come back, or if we get reinfected?
Some doctors do. I spent some time with Dr. Horwitz in his office. He's saying you're on this for life, okay? And I use a lot of Byron white herbs, which are AL, ABAB, ABART. Probably some of you heard of those. They're excellent. I joke with people they're nuclear powered, and we all laugh, and they come back and they go, "My God, you weren't kidding, were you?" I'm like, yeah, I use a lot of humor, but it's usually, there's some truth to that. And they're extremely strong, and there's an idea in this country that if it's not made by Pfizer and doesn't cost a gajillion, it's not good. We use 80% of all pharmaceuticals produced in the world in this country. So what's wrong with the rest of the world that they only need 20% and we need 80%? But we need a pill to go to bed, we need a pill to wake up. I've had patients come in, I need more insulin because I want to eat more. I'm like, you're in the wrong spot. I came to the wrong doc for that,
So are your herbs much more powerful than Nutrimetics, or?
I use Nutrimetics too. They're not mine. I mean, I use different brands. I use Nutrimetics too. I use their Cemento, I use their Banderol. That's a very high quality company. But I only use pharmaceutical grade everything in my office. Getting back to, I still haven't answered the final question. I don't. When you meet my graduation criteria, I say, you're done, okay? Finish up what you have and then we're done. And you know my phone number if something happens. And my graduation criteria is you have to come in and say, I feel like I think I should feel, okay? And your CD57 has to be normal, which is the hardest thing to get. And your C4A has to be normal. Those are 2 blood tests, okay? And out of those, the CD57 is the hardest one and the longest one to come back and get back to normal.
So would you, I know this is an extremely difficult question, but on an average, would you say, maybe she knows more, the average person, what's the cost going to be before we might be to that point?
I think, and we haven't sat down with pencil and paper, but in my shop, probably you're looking at between $6,000 and $8,000 for 18 to 24 months of treatment before I started using the IVs, okay? I think that right now it's a new paradigm for me. I mean, I've been using this almost a year. And I'm seeing people, and I have to keep readjusting my thoughts, because I'm like, okay, I've been working on this patient for 14 months. And I look down and it's like, 4 months, crap, you know. People just don't get better that fast with this disease. But some do on the IVs, and it's really, I've had some in 6 months, so that, I think, cuts the cost by about a third, at least. And we're learning more all of the time, you know.
How many people go beyond the 18 months? What rough percentage?
25 maybe, 20,
You got
25.
people come in with dealing with this for 2 or 3 years already.
Most of my patients are quite sick. Most of them have, virtually all of them have chronic Lyme. I mean, anybody that comes in with 1 or 2 years of Lyme gets a hug.
I mean,
I mean-
treating with another Lyme doctor.
Or not even diagnosed, you know. Most of my patients, I would say, I don't know, some for their lifetimes. You know, when we start taking their history, and, you know, it's like, well, you know, in high school, I hurt all the time, you know. I'm like, okay, you're 16, you're taking naps, and you hurt all over. I've been 16, I didn't hurt all over, I didn't take naps, I still don't take naps. I mean, I don't, you know, come on, 20-year-old taking a nap, really? I mean, maybe in college, but there was a good reason for it then, but, you know. So you start hearing these stories, and when people learn more about Lyme, they go, you know, I think I've had this longer than I think. So I would say the majority of my patients are 5 years to lifetime.
I'm thinking specifically of myself or other people here that I've been treating with a Lyme doctor for over 2 or 3 years. And obviously it's chronic.
Yep.
Is it a tougher nut to crack when somebody's coming in the room?
Yep, and really the best correlator that I've seen, and I've been looking for a correlator on that population, I like to be able to predict things, and give people an idea about their prognosis. The best one so far has been their CD57 count. And do people know about that here, or not?
No.
Let me go through that, okay? CD57 is a group of cells in our body, and I call them our hitmen or our bouncers, okay? They run around the body, and they're looking for a foreign protein. And when they find it, they feel it's a bad guy. It's probably a bacteria, virus, or a parasite that shouldn't be there, so they try and jump on it, beat it up, and throw it out. Well, bouncers down here on the corner bar don't always win, okay? Well, I don't know, maybe this is a jungle town. In Oshkosh, they lose sometimes. But there's only 5 things that we know of that beats up this particular set of bouncers. Leukemia, lymphoma, chronic tuberculosis, or AIDS, or Lyme disease, okay? So CD57, everybody gets a CD57, okay, in my office. And that gives me an idea. Now, it should be greater than 120. This gentleman that I talked about that I've been working on since 2012, and now I think he might have developed psoriatic arthritis. His CD57 was 9 when he came in. I mean, and I'll tell you a secret, but don't tell anybody because I charge for this, but I don't fix anybody, okay? You guys know who has to fix you? Yeah, so, but you have to have the tools to do it. And if you come in, that's your big toolkit to help fix yourself. And if your immune system is that trashed, I mean, the first 6 months of treatment in somebody like that is just like, okay, we're just gonna try and stop the bacteria from reproducing and try and let you work on getting your immune system up, getting the toxins out. Because I really haven't even started treatment for 6 months probably, because people think that the antibiotics go in and just machine gun the bacteria, and they're dead. And some bacteria are killed by the antibiotics, but the majority of antibiotics really work by, they grab the bacteria, they sit on it, they don't let it reproduce, and they hold it down until your immune system can come along and clean it up and throw it out, okay?
Is that bacteriostatic?
Well, even the bactericidal drugs, that's a lot of them, I mean, there is some killing.
They're just kind of keeping it down.
But they prevent it, number one thing they do is prevent it from reproducing, okay? Because they reproduce at a very rapid rate. Like I said, 510 million. And I've never heard anybody talk about that, but I got that off of that Mayo Talk. But that's a lot. That's a lot.
So there's one guy who was at 9 and he should have been at what?
120. Well, actually, he's a young, healthy guy. He should be healthy. He should have been probably about 260. And he's at 9. I mean, I've seen people at 5 and 4, and I mean, that's bad.
So So after treatment, where's he at?
Well, he's very functional. He's got his brain back. He's a very, very bright individual who does a lot of computer work. And he's got his brain back, and he's about, he said he was about 85% when he was in my office this week. But he's not 100%.
So what did it for him? That you think, that you can put together?
Treatment since 2012. Everything that I can think of. He has not had the IV treatment yet. And I really am trying to convince him that he needs that, because I think that's the only way to treat some of these things. So,
Is the CD57 a blood test?
yes,
Is that something that, like I could have that done through another doctor just to see what mine is?
you could try. The reason we do them in our, we do that in the C4A in our office. And we tried to give that slip to people and have them go. And their doctors look at it and go, I don't know what this is. And nobody else in the world does it, except Lyme. And it's done at National Jewish. And most labs will say, well, we don't know what this is, and we don't know where to get it done. And everybody we call says they don't do it. And it's a little difficult to get done. You know, any doctor can do it. Just draw the blood and send it to National Jewish. It's not hard, but most don't.
And that's a good predictor of your inflammation level?
The amount of damage that Lyme has done to your immune system.
So any Lyme doctor should be aware of a CD57.
Yeah, probably any Lyme doctor is aware. Not everybody believes that it's, Dr. Horowitz, for example, doesn't use it. He's like, well, I don't think it's that good. I do. I know a lot of docs that do. I know a lot of docs that don't use it. For me, it's a very good predictor. And I know 100% that if we stop everything, I don't care how you feel, if you feel perfect, and I've had a number of people prove this to me over and over again, usually guys, sorry, I feel good, I don't need this anymore. But your CD57 isn't normal. You have 100% chance of relapse if that CD57, in other words, if your immune system can't handle it, can't handle it on its own, you're gonna relapse.
Where would you have to be at minimum on a CD57?
120.
120. Okay. Could go as high. She got a question.
Thanks.
Oh,
Yeah,
I'm sorry.
I thought that might help.
yeah.
I've been trying to ask for probably 15 minutes. So the blood smears, do you guys do that microscope thing underneath to look for the spirochetes, and what do you really feel? That's my first question.
Okay.
My other question was to come back to the tularemia you mentioned in the beginning, because I had an odd correlation with my pet rabbit, and I said it years ago. We had very similar symptoms, and I've always been going like, well, why is this so uncanny? We both ended up with dry eyes, and so anyways, I'll let you speak to that.
Okay. I'm working on getting, it's called a dark field microscope.
Okay.
They're pretty expensive, okay? I have limited space in my office, but I have a patient who's willing to give me one. I'm working on getting that, but that's not a routine thing that's done. It's more a research thing. I have a friend that has one, and when it's in Kakana, it travels, but when it's in Kakana, they have only looked at one person's blood from Wisconsin and not found spirochetes, okay? If you look long enough. Now mine, it took a while. I grew up literally 100 yards from the hotspot of Lyme in Minnesota. Yeah, lucky me, okay? I'm sure I've had it my whole life. My blood we had to look at about 25 minutes before we saw one of the little buggers crawl out. But that's when I decided I was gonna start treating myself, okay? Or get treatment. But I might have one of those in the future. It's kind of gross though when you see that, because it's like coming home and somebody's been in your house that you didn't invite, okay?
It's really excellent physical evidence, though. I mean, you can't.
That's pretty darn good physical evidence
So-
to me, not to the rest of the medical community.
Right.
But when you see the spirochetes in the blood, either you've got syphilis or you've got Lyme. And syphilis isn't very big around here. Maybe New York City, but not here. So yeah, I'd be voting on Lyme if I saw the spirochetes there. The dry eyes with the rabbit.
Yeah, what was the tularemia thing?
Tularemia is,
Tularemia.
it's a very bad disease, and a lot of time it's fatal, okay? You would have had very large lymph nodes, you probably would have had open sores on your body. The rabbit probably would have. On the other hand, dry eyes, as I've come to learn, is extremely common with Lyme. And one of my nurses, who in the last 9 years, 10 years, she's worked for 2 different Lyme doctors. She's been treated for 9 years. She's had the best treatment. She teaches people about Lyme. She's got the best knowledge. She's had the best supplements. She's had the best everything. We could get her to the curb, but we couldn't push her off. I mean, either her former employer or myself couldn't get her feeling good until she did the IV treatments. And I still remember, it was a Tuesday morning, she came in and she said, "I didn't put eye drops in today." And I'm like, "Okay." She's like, no, you don't understand. I've been putting eye drops in 5 and 6 and 7 times a day for the last 15 years. I didn't have to put them in. And she still doesn't. If it's dusty, or, in the fall when it was dusty and everybody's in the field, she had to put a few in. But the IVs pushed her over that curb and got her the rest of the way healthy. And that's why one of the reasons I feel it treats things that nothing else treats. But the dry eyes are very common with Lyme. If you had tularemia, you would have been very, very, very sick.
Yeah. Well, the funny thing is that the bunny early on had a dry eye thing. We both had the Schirmer test. I mean, that happened years before my dry eye set in. And then I was like, what are the chances of that, right? I mean...
Chances your bunny has Lyme is pretty good.
Right?
Yeah.
Yeah, that's what I was thinking.
Yep. In the far back there.
Have you treated or run across a lot of people with autism and Asperger's connected Lyme?
I have ADD or ADHD is very common in pediatric. And in pediatric population, Lyme usually presents as behavioral changes. And it's usually like dropping off a cliff. Little Johnny was doing fine until 4th grade, and then boom, A's and B's to C's and D's, and teacher calls up and says, "He's disrupting class, I want this kid on medicine." I mean, I've had some, I'm not a specialist in this. I don't know if there's a direct correlation or not, but I know that a lot of the same treatments for Lyme will help with that, and mainly diet, nutrients, supplements will help with that. But I don't know exactly
Oh, so
if
you
they're
don't
directly
see-
correlated.
Oh, you don't see necessarily Lyme as being a cause of it?
I can't say that,
Oh, okay.
okay?
Mention
Karen?
the age group for the IVs.
Oh, since this is in a study, the age limitation is 18 to 70 right now for the IVs, so.
If I could address the autism question, Dr. Brown came and spoke to our group, and it was very interesting. He has a lot of autism and PANS children, and in his estimation, he says approximately 80% of his children with autism/PANS have Lyme. So there is a great connection. And I don't know if that's because we're in a hub. I don't know. But he's a great resource for you.
Okay, how would I find him?
He's at Serenity Health in Pewaukee,
Waukesha.
or Waukesha, sorry, Dr. Brown.
I think he's retired.
And he's a lovely man.
And it's a problem. It's like, if you look at all brains of patients that died with Alzheimer's,
Yeah.
well, you find Lyme in a lot of them, okay?
Which
Well,
came first?
I'm sitting there going, if we looked at everybody's brain in the room, if we just looked at your blood, if it's in your blood, it's in your brain. I mean, we find, is it true and unrelated, or is the Lyme there causing this? Lyme makes everything worse, okay? I do know that. So, and there's so many symptoms to it. The leading researcher for Lyme in the country feels that Parkinson's, ALS, and Lyme, or MS, ALS, Parkinson's, and, all right, what I said, all 3 of those are actually Lyme disease. And I don't know, I'm pretty much a believer that almost everybody with MS out there actually has Lyme disease. Parkinson's, I don't know for sure. ALS, I have a lot of ALS patients that are doing really well. As a matter of fact, I'm upsetting a lot of their doctors because they're not dying. And,
Because you're treating them for Lyme.
oh yeah, and they're doing fine.
Yeah.
And I mean, it's sad, I'm not kidding you, but we were talking before everybody out here about the closed-mindedness. One of my ALS patients was going to a doctor in Freighter, and I've been treating him for quite a while. The only symptom that he has is a foot drop. Now, a foot drop is, when you walk, you kind of lose motor control over one of your feet. And if that's there too long, it's not gonna come back even if you're 100%. So I don't think that's ever gonna come back, but no other symptoms. And he asked his Lyme doc one day, and he says, well, 2 other guys were diagnosed with ALS the same day I was. He said, they're both dead. And he said, my symptoms haven't progressed. He said, how do you explain that? Oh, well, it's highly variable. You're still gonna die. Well, so is everybody in the room. But he said, well, I'm seeing this guy in Oshkosh, and he's treating me for Lyme. Oh, get away from that quack. That's absolutely ridiculous. He's taking your money. There's nothing to that, okay? I mean, it just really read him the riot act, and the guy went, okay, see ya. But he sits out in the waiting room and talks to everybody else out in the waiting room, because this guy is always about 2 hours behind. So guess how many ALS patients I have now, and for the most part, they are all doing really well, but none of them tell them what they're doing. But even this guy came back and said, if all of your patients died and you had one that didn't, don't you think you should be all over that as a doctor trying to figure out why? No, stay away from that quack. And I've had a lot of ALS patients with wonderful results, back to full lives, basically functional, 100% functional. Now, I've lost some too. I've lost Lyme patients, okay? If somebody gets to you too late, and there's too much damage that's done, and contrary to the popular belief that Lyme doesn't kill everybody, it's okay if we miss it. I got told that in medical school. Now, if you miss Lyme, it's not that big a deal because it's not going to kill anybody. Yeah, it does. And I've seen it. And cardiologists now are starting to figure out, I've got a cardiologist at Freighter that we've had enough patients together that he's starting to come around. Last year, 2 21-year-old and a 24-year-old young, healthy, strapping males died on the East Coast from myocarditis, cardiomyopathy due to Lyme. And like I told you about Dr. Spencer earlier, some of the cardiologists are starting to figure this out. I had one patient from not far from here, big, strong, strapping guy, fireman, got to the point he couldn't work anymore. When he came in to see me, he just had his 4th cardiac ablation. And that's where they go up through the groin with a catheter up and fry part of the heart because it's in a bad rhythm, okay? Usually atrial fibrillation. And it's a short circuit in the wiring of the heart. So they try and treat it by going up and destroying part of the heart, killing part of it, which kills the nerves that run through there, and hopefully you cut out the short circuit, okay? He'd been getting this for 20 years, 4 ablations. They'd never been able to figure out why he had atrial fibrillation. He was on huge antiarrhythmic drugs that were worse than the Lyme. He could hardly function. As a matter of fact, he was having to quit his job. And I diagnosed him with Lyme. I mean, a pretty clear case of Lyme. I mean, classic Lyme. And he said when he went back to his cardiologist on this post-4th ablation checkup, he said, well, this guy just diagnosed me with Lyme. And he said the cardiologist hung his head, turned about that color, and went, yeah, that could be your problem. Nice if he would have figured that out 22 years ago. And we got this guy is fully functional now. He's down to all but the smallest dose, I think, Sotalol. I think he was on, that was his antiarrhythmic, I think he was on 180 or 200 milligrams of it, and I think he's down to about 40. We haven't been able to get him off of that because I think he's had so much damage done to his heart from all the frying that they've done, but he's back fully functional. And he didn't go see his cardiologist anymore. But at least cardiologists admitted that could be.
That's rare.
That's not that rare.
Well, I mean,
No,
it's
that they-
steady.
Oh, that he would, yeah. Yeah.
I'm curious, do you do any labs for co-infections, especially babesiosis, and also, again, with babesiosis, do the UV treatments help with that?
Probably one of the things that does the best.
Okay.
The labs for co-infections, the co-infection panel through IGeneX is $600,
Yeah.
okay? It usually comes back equivocal or negative, even though you're sitting there telling me, I've got night sweats, I can't remember my name, I get lost going to the grocery store or coming home. Absolutely classic babesia, and then on my exam, you've got little red streaks like here that looks like stretch marks, and you say my feet hurt when I get up, and I know you've got Bartonella, and I do the test and it comes back negative, okay? There's another technique that I use in my office that is a whole lot cheaper and I think a whole lot better. And I'm not gonna talk about that because I'm on tape right now, but I have a way of checking for those that I think gives me a pretty good idea. Clinically, I can come up with Babesia and Bartonella, and probably at least 85 or 86% of people that have Lyme have Babesia. So I don't generally test for those because it's usually non-helpful, even though I know you've got it.
Okay,
I treat for them all,
yeah.
but I've got another way that I look at that.
Okay.
And I personally think it's a pretty good way, but it's non-diagnostic, so I can't really use it.
So if you have
Okay.
Bartonella, you can pretty well be assured you have babesia also.
If you have Lyme, you probably have Babesia. I don't think I've ever met, I maybe had one patient in my entire career that just had Lyme, okay? Maybe one. I can't think of any of my Lyme patients that did not have Babesia, and I think the majority of them probably have Bartonella too.
Are the co-infections introduced at the same time you acquire the Lyme?
Yeah. Yep. Or at another bite. I mean, you can get Lyme a lot of times, and there seems to be a bimodal distribution of Lyme symptoms, and that's usually 9 or below or 50 and above. And I don't know whether that's because, the kids are running around like banshees on the grass in the woods, have a high exposure, excuse me, or the people in the middle have pretty strong immune systems, between 9 and 50. You're pretty healthy normally if you've got a pretty good lifestyle. If that's the reason, certainly they're exposed. My next door neighbor to where I grew up in northern Minnesota, he lives in the hot spot of Lyme. Mine was 100 yards away. He lives in it. He works for the DNR in Minnesota. He's had Lyme at least 3 times. He's my age, and he looks like he's probably 75 and crippled. And the way he's hobbling around, and I'm pretty sure he's never had adequate treatment. You can get it multiple times. And you can have it, and it can sit there dormant until a major stressor. And that's a lot of times what we see in adolescents, or we see in adults. And, I was doing fine until, I got married, we had a kid, I sold, we moved, and then I started a new job, and I haven't been feeling so well lately, Or I got divorced, or we went through bankruptcy, or, a 5-hour operation that was supposed to be a 20-minute appendectomy, and, and that just lets Lyme go boom a lot of times.
The fibromyalgia aspect, we all, most likely with our Prozac, we've been told we have fibromyalgia.
Mm-hmm.
What's the connection there? Is there?
I don't believe in fibromyalgia.
Exactly.
I don't believe in irritable bowel syndrome. And if you take the last 2 letters of the abbreviation for irritable bowel syndrome, that's what I call those diagnoses. And it's basically, okay, you've come to see me, you paid me money, I know everything, so I gotta tell you something. Okay, you've got irritable bowel. By the way, we can't do anything about it, so kind of just go home and suffer. Or we could try you on these immune modulators, which will destroy your liver and your kidneys and probably your life and give you cancer. But otherwise, live with it. So to me, those diagnoses are a set of symptoms, but that's not the problem.
But what might that be that's causing us where someone pushes on us, our legs especially, that hurts? It hurts to be
Lyme.
massaged or touched, or that's just the classic Lyme. not one of the co-infections, just
Oh, that's
classic.
pretty classic, okay. I mean, it's inflammation, okay? And again, I go for inflammation, and we look at the whole individual, we don't just look for Lyme. I try not to look for Lyme. I get really excited when I have a non-Lyme patient. But even wellness patients that come in, the longer I talk to them, I'm going, crap, I got another one, you know? It's just so common. I really look forward to having somebody that's not Lyme to treat,
Mix it up.
you know, and probably 85% of my patients are on Lyme. I mean, I've got bioidentical hormones, I've got health and wellness, I've got, you know, cardiac, I've got some other things too, but unfortunately, most of my new patients that come in for whatever, I'm like, oh crap, we're gonna do some Lyme testing on you. You know,
Do you, in your opinion, do you find that like kids or adolescents respond well to treatment, like more so than adults because their immune systems haven't been going longer? Like,
Yep.
I've had Lyme for 15 years. I've been in treatment for a year and a half. Just found out I gave it to my husband. He also has Lyme, and now I found out my 15-year-old daughter has Lyme. So I don't know if I gave it to her or if she was bitten as a kid.
Okay.
So I can handle it myself. I know my husband can handle it. What kills me is that she has it.
mhm.
So do you think that, this is just, you know, totally your opinion, but that she'll respond quicker, faster than say like an adult would?
Well, a couple of things. First of all, I think children do respond better. Their chi, their whole life energy, their immune system is so strong. They do everything faster than anybody in this room does. And usually they respond pretty well. With children, I like if they're doing well, if they're growing well, if they don't have the behavioral issues, I like to let them get as old as you can before you have to start treating, because they'll respond, at least to a point, they'll respond better to the drugs. We can use more drugs. Their immune, you know, their bodies are just more resilient, okay? For some of the harsh treatments that you have to use. You know, don't do the bad mother thing because you might have had Lyme and you passed it on to your child, okay? You live in Wisconsin?
Yeah.
And do you go outside? Okay? Yeah, well, so does your child, okay?
I don't know whether I gave it to her or not. That's not my concern. My concern is that she now feels like I do and it kills me.
Yep, and I hear you. And then if she's feeling bad, she needs to be treated. But,
Yeah.
you know, whether or not, I mean, if you live in Wisconsin and you go outside, even if you don't go outside, but your dog goes outside, I mean, you can get Lyme, okay? Potentially if you get a mosquito bite, all right? I haven't had one for about 2 months right now, but pretty sure I had one a little bit before that. And how do you know you gave it to your husband? I bet you he lives in Wisconsin too, huh?
Yeah.
Okay, and he goes outside,
Yeah.
yeah.
Not very often, but it does.
I'll tell you, I have a lot of housewives from Chicago that I treat, and their idea of camping, their tents have Hyatt and Hilton on the top, okay? And they go, where did I get Lyme, you know? I'm like, well, do you have mice in your neighborhood? Well, sure. You know, do you have rabbits? Do you have raccoons? Sure. As a matter of fact, we have deer, because there's a few trees over there, you know. So, you don't know that you gave it to your husband, maybe, maybe not, but he does the same things, lives in the same spot you do, so, you know,
I guess that's just my assumption.
yeah.
'Cause he wasn't feeling this way, you know, 10 years ago before he met me, so.
Guys are tough. I can do this, isn't bad.
No, he just thinks he's getting old and he's, you know, he's only 47.
That's
I'm
not
like,
old.
your hip's not gonna go out at 47.
No. No, but guys are tough.
Yeah.
I can handle it, sort of.
I have one more question. Have you ever heard of this, diatomaceous earth?
Diatomaceous earth.
Yes.
That's a mouthful, isn't it?
Yeah, I don't
Yeah.
know how to pronounce it, but,
Yes.
what do you think about that?
Diatomaceous earth is a sponge. It's a lot like bentonite clay or some other things, and it soaks up a lot of toxins, okay? Which can be good and bad. Now, we have to be careful about detoxing people when we're treating them for Lyme, because sponges are non-discriminatory on what they soak up. You know, you've got some bourbon, you've got some soda, you've got some water on the sink. That sponge doesn't care, it'll soak them all up, okay? So it'll soak up antibiotics, it'll soak up vitamins, it'll soak up minerals, okay? So if someone, you've gotta be careful not to have somebody taking out what you're trying to put in to help them. And, sometimes that's why we're, all my patients, if you're taking something, I need to know about it. Well, it's just diatomaceous earth. Okay, maybe this is why you're not getting better. So you really have to talk to your doctors and let them know, because you can think you're doing something good, but you're actually doing something that's counterproductive.
Okay.
Now, you mentioned you were infected with Lyme.
Excuse me, we got a question back here.
Just talking about persister cells, and I know I've heard a lot about dapsone coming on the